The Faith Research Network, supported by the National Institute for Health Research, is dedicated to advancing care models focused on a shared responsibility for self-care and well-being. Guided by community research to identify root causes and employing a knowledge mobilization approach to prevention, the network develops social prescribing care models that connect individuals and families to community health services aligned with public health priorities. The network's operating system includes digital platforms that enhance communication and collaboration among voluntary, community, faith, and social enterprise organizations, as well as external partners, to strengthen institutional capacity. This is supported by a systems thinking approach, transformational leadership, resource management, and advocacy programs delivered through communities of practice sessions, toolkits, and research initiatives, including Prostate Healthcare Research Alliance, Sickle Cell Central, Women's Healthcare Research Forum, and a Workforce Community Integration Research Forum. The network prioritizes professional collaboration as a proactive civic duty, fostering cooperation and collective action through neighborhood and local community hubs.
Hello once again, and it's really good. We have David Victor, who's a data scientist, and in fact he's the developer of a cancer health dashboard, which is really important because in our work we talk about evidence begins with experience. So to have a tool that will contribute to us being able to translate research recommendations into workable programs and activities for a shared learning approach to improving self-care and well-being across our communities in our neighbourhoods. So, David, I'd like to commend you first for producing this tool. Very well done.
Thank you.
David, tell us, why is the Cancer Health Dashboard being developed?
Thank you, Rudy. The dashboard is being developed as a platform for providing and supporting evidence. And we do this in two ways. The first one is making it possible to actually integrate data from several agencies. All this data is dispersed, kept in files, and locked in other areas where people are not even aware of them, but it could be useful. So that is one of the ways that we are doing this, is to bring all this data together and support and provide evidence for people working in this sector. The other one is to be able to visualize the data, don't just read the numbers, so that it makes it easy for people to interpret and generate insights for themselves. That's much, we don't all have the technical abilities, but merging all those abilities together will improve the work for people who are doing much more work down the road. So that is one, those are two reasons why the dashboard is being developed.
And how can voluntary community faith social enterprise organizations help to ensure that their community research and lived experience complement the health intelligence that is being provided by the dashboard?
Thank you. These organizations are really, really important, to not just because of the work that they do, but also for the platform, because they actually validate and provide nuance about these communities that we want to reach out to. So when the data might give you the statistics, there is a real meaning behind them that could explain things like patterns or outlying issues. And the work of these community organizations actually validate what this data is trying to portray. So it's really important that we have them on board.
Excellent. And how will the Cancer Health dashboard helps strengthen partnerships between communities, healthcare providers, researchers, and the voluntary community, faith and social enterprise sector.
Thank you. So by coming together, we hope the platform will enable all these professionals, number one, to work jointly on projects. They can be able to, just narrow down on a particular set of things and generate reports, generate analysis, generate recommendations, compare with the policy papers and such activities. So the platform is bringing all that together, and by bringing everyone together, they can work and move forward from there, build their own partnership. So it's like it's provide evidence for further partnership in these for these organizations and for their work that they are doing.
Yeah,
yes.
And I understand, because what that will assist the ecosystem of organizations that exist, particularly with the new neighborhood health service still in development, of course. This will be an essential tool for the complete ecosystem. So well
Yes.
done on that.
Thank you.
Finally, for organizations that would like to contribute to the development of this initiative, how do they make contact with you?
The best way to make contact is to send us an email at victor@afiuk.org. That is victor@afiuk.org. Or you can visit the platform at cancerhealthdashboard.com, and you can find more information there. And we are more than open and willing to work with everyone interested to moving this forward. So that's how you can contact us.
So thank you very much. Congratulations once again. See you again soon.
Thank you, Rudy. I hope to have more conversations with you. Thank you.
Bye.
All right. Bye-bye.